which include chronic pain. So let me just press go so I can actually see. So yeah, so we're going to share some things. We can have a look at a couple of things. We've got a little video to show you as well. And then we'll open for questions. So just going to start by sharing our screen. So the wrong page, but it's okay. So we're going to look at a quick an overview, as a program overview of what we offer and how we can help. But we're going to specifically stay with the pain, but we're going to just give you a general overview before we start. So we do some 6 and 8 week courses. So these include living with long-term health conditions, and that includes long COVID, as that's become a bigger problem and it is an ongoing thing. So we have added that to our long-term health conditions course to be able to help people who are living with that condition. Living with persistent pain is our most popular course, and there are more people in pain in Wales than there are 3 times as many more people in pain this year than they were in 2021. So that's a lot of people. We do a lot with living with diabetes and fibromyalgia. So the diabetes course is a 7-week course, including stance foot kit, and fibromyalgia is an 8-week course, which is specific to people living with fibromyalgia. And then we got a Caring for Me and You. That's a course for carers. And we also do a cancer thriving and surviving course. And then we've got the single sessions. So we do one-off sessions, which is an introduction to self-management, an introduction to pain management, an introduction to living with diabetes, an introduction to living with pre-diabetes, diabetes foot care, which is called Stance, and 5 ways to well-being. So what is self-management? So self-management is keeping informed about your condition. So knowing what you can do day to day to help yourself, understanding what may worsen your conditions and what may alleviate symptoms, and working in partnership with your healthcare professionals. Because how many of us sometimes feel alone when we're dealing with our health conditions? You feel like nobody is listening, you feel like nobody is there to help. And actually, if we manage ourselves to a point, we are able then to go in with more confidence to ask for the help that we need. And our courses really help with that. We look at the communication, we look at many different tools, which we will go into shortly. But we go through, we've got a lot of tools that can help with your own self-management. For a bit of a personal explanation of who we are. So I was in a really dark place and wanted to end my life due to pain. It was just, there was too much going on. I couldn't cope anymore. And somebody put me on the EPP pain course. Within 20 minutes of being on the course, something switched in my head. I no longer wanted to die and I felt like I had purpose again. So straight after that course, I was asked to become a tutor. So I was then a tutor for 2 years, delivering 3 courses a week, just trying to get this out to as many people as possible, because it changed my life completely. It got me from being in a wheelchair and not going out and walking to being able to walk with crutches and sometimes without now. And much more active, much more confident. I'm able to manage my pain and deal with the difficult emotions that come with that. And from all of this, I've actually got myself well enough to be able to work again. And that's something I never thought I would, because I lost my job in 2019 due to my ongoing health conditions. And now I've got myself a job again, and that's something I would never thought I would do, but it's using these self-management courses that really, really got me to be able to control everything. So I now control myself. I will, when I go to see the GP, I know exactly what I'm asking for. I know what I want to hear. If it's not what I know, sorry, I'll start again. If it's not what I think is going to happen, then I will ask why. I will ask the question. So I make sure that I've got informed choices before I attend. I always work with my healthcare professionals. I have a great relationship with my GP, my specialists, with the pharmacist especially. We have an ongoing relationship with how medications work, if I've got any questions, speak to them. And all of this has come from doing one of these courses. So we're going to have a quick look at what is pain. Now we're going to go through that, because we suffer pain, whether it be acute or chronic, and acute being like a broken bone or, you know, toothache, and then chronic being any pain that lasts longer than 3 to 6 months. But where does this pain come from? And that's a question that we're going to have a look at today and hopefully give you an answer to. Yeah. So I'm going to pass you to Helen.
Okay, hi there. As I said, I'm Helen. And we're both involved in delivering all of these courses. Today we're going to concentrate on the pain, but there are other ones. And the way that self-management helps is, as well as Amanda said, you know, it's sort of turned her life around. But of course, just being on a course with other people with similar symptoms and sharing ideas, and a lot of it is about practical solutions. So as Amanda said, what we're gonna do is just go through what is part of our pain course, and this is quite important. It's what is pain. So I'm going to take us through that, and then we're going to go and have a look at some of the tools that we use throughout the course. So the question is, what is pain? Because over the last few years, we have actually learned a lot about pain, and as you know, this can happen anywhere in the body. But you might actually be surprised to learn that we don't feel the pain until the pain signals travel through our nerves to the brain. And then it's the brain that interprets the signals as pain, and it tells us where that pain is. But things other than pain are also processed in this way. You know, sometimes you're in the supermarket and then you catch sight of a friend down one of the aisles. And when you see them, you feel sort of happy emotions because you've seen somebody you know and you like. And in this case, what happens is your eyes convert the light into electrical signals, which are sent to the brain. The brain then turns those signals to images that we remember. And when the image is related to a good memory, we experience happy emotions. Of course, the opposite could happen. If it's someone you don't want to see, then you might sort of have your fight or flight signals turned on, and you might just go down the other aisle. But this is the way that the brain actually interprets these signals. So the friend and the eyes were both necessary, but until the nerves actually send the signals to the brain and the brain interprets these signals, there's no recognition or happy emotion. And this is similar for pain. Something stimulates the nerves, but until the nerves send the signals to the brain and the brain interprets the signals, we don't actually feel the pain. However, we know sometimes in the body there are no nerves and therefore no pain. So, for example, when we cut our hair or our fingernails, we don't feel pain because there are no nerves in either our hair or our fingernails, which is just as well, really, isn't it? So, you can see there, we've brought up to show you our neuromatrix network. It's not easy to say, okay? And this actually shows how the pain is produced by the brain. You don't have to remember this, but just a diagram to help you understand what we've just said. So the thoughts and the body sensations and our emotions are all sent to the brain by our nerves. And this is called the neuromatrix network. Our thoughts and our emotions, both positive and negative, influence this network, as well as the impulses carried by the nerves from all over the body. And these nerve impulses can be from an injury or just ordinary things such as breathing or knowing that we're actually sat on the chair and feeling the chair. So all this information from our thoughts, emotions, and body sensations, all the information is processed by this network. So if the brain, then thinks that the body is in danger, then there are three things that happen that you can see on the right-hand side of this diagram. First, we feel pain. So second is the action bit where we do something to protect ourselves from this pain. So for example, if we put our hand on a hot stove, the first thing we do is to pull our hand away. Or if we've trodden on something, we lift our foot up to take it away. And if the pain is severe, we get help. So those are the actions. And third, our body releases special chemicals, which are neurochemicals. And these are released throughout the nervous system and the brain to regulate the stress. So you can see there, the purpose of acute pain is to protect us from danger. It helps us to survive. Because pain makes us take action and gets our body ready to deal with the stress. So usually acute pain goes away once the healing has occurred. And most tissues heal by 3 to 6 months, or 3 months, sorry. And broken bones take up to 6 months to heal. But what we talk about in our course is chronic pain, okay? And chronic is another word for long term. This is pain that lasts for more than 3 to 6 months. So this is pain that continues even after our healthcare providers have ruled out any specific disease or injury to cause the pain. The nerves and brain continue to produce pain signals even though the tissues have healed. Sometimes chronic pain, such as arthritis, has a cause, which is, so the cause is known because it's arthritis, because joints are damaged, muscles and other surrounding tissues may be weak and stressed. And sometimes there's inflammation. But even if we know the cause, the tools on this course to treat that are often helpful. So we know from research that chronic pain is less about damage to our body and more about the sensitivity of our nervous system and how the brain interprets that information. And that's why two people can have the same condition yet experience very different pain. So there are some things to know about chronic pain, which we've just gone over. The causes of pain can be anywhere in the body, but we don't feel the pain until the brain tells us it's pain. So our thoughts, feelings, and actions affect the pain. Chronic pain causes our nervous system to become oversensitive, even to things that don't normally cause pain. And an oversensitive nervous system tells our brain to protect our body, which is not helpful because our brain is misinterpreting nerve signals as danger, but there's no new danger. So we can change our nervous system and teach it to be less sensitive, and we can do things to help, okay? Because the nervous system is changing and adapting to new information all the time. So the important thing to know with our pain is that we can control a lot of this information, such as our thoughts, our stress, our feelings, and behavior. So with chronic pain, we actually have to look at the big picture because so many things affect our nervous system and brain. And this is good news because it means there are many things that we can do to manage our pain. And that's basically what our course is all about, is what we can do to help our body to manage that pain. Okay. So that's our sort of explanation of pain. Do we have that video?
Yeah, I'm gonna show you a video now, which explains it extremely well.
Yeah.
It is based in Australia, but due to the numbers, it's very, very similar to what it is in Wales. So I'll send it through, but what I'll do is afterwards, I'll send it through to Esther, sorry, losing her voice. And then she'll be able to send it out to everybody. So you can have a look at it again, because it does go quite quick, but it's a really, really good video. Let me just get the right page up. Bear with me 2 seconds. Ignore the ad first. No. Okay. Sorry, there's lots of buttons to press. Yeah, there are. Okay, can you give me a thumbs up just to make sure you can hear this when it eventually starts talking?
Everyone agrees that pain is a universal human experience. We now know that pain is 100% of the time produced by the brain. This includes all pain, no matter how it feels, sharp, dull, strong or mild, and no matter how long you've had it. You might have had it for a few weeks or months. This is called acute pain, and it's common with tissue damage, say from a back injury or ankle sprain. And generally, you'll be encouraged to stay active and gradually get back to doing all your normal things, including work. Or you might have had it for 3 months or more, and this pain is generally called persistent or chronic, because in this type of pain, tissue damage is not the main issue. What's less clear, though, is when you're told you have chronic pain, is knowing what's best to do about it. Well, in Australia, chronic pain is a really big problem. In fact, 1 in 5 people have it. Having a brain that keeps on producing pain, even after the body tissues are restored and out of danger, is no fun. Some people say it still feels like they must have something wrong. But that's just it. Once anything dangerous is ruled out, health professionals can explain that most things in the body are healed, as well as they can be by 3 to 6 months. So ongoing pain being produced by the brain is less about structural changes in the body and more about the sensitivity of the nervous system. In other words, it's more complex. So to try and figure out what's going on, you need to retrain the brain and nervous system. To do this, it's helpful to look at all the things that affect the nervous system and may be contributing to your individual pain experience. What can help is to look at persistent pain from a broad perspective, and by using a structured approach and a plan, it's less likely that anything important will be missed. Let's start with the medical side. Firstly, taking medication can help, but only to a limited extent. It is the more active approaches that are necessary to retrain the brain. So using medications to get going is okay, and then mostly they can be tapered and ceased. Some people also think surgery might be the answer, but when it comes to a complex problem like chronic pain, surgery may not be helpful. So if you're thinking of surgery, it's best to get a second opinion, and remember to consider all the things. Next, it is helpful to consider how your thoughts and emotions are affecting your nervous system. Pain really impacts on people's lives, and this can have a big effect on your mood and stress levels. All those thoughts and beliefs are brain impulses too, but you can learn ways to reduce stress and wind down the nervous system. This helps with emotional well-being and can reduce pain as well. The third area to consider is the role of diet and lifestyle. Now, it turns out that our modern lifestyle might not be so good for us. In fact, what we eat and how we live may really be contributing to a sensitized nervous system. Looking at all the things like smoking, nutrition, alcohol and activity levels, and seeing if there are any issues is a good beginning, and these things can go on your plan. Then there's often enormous value in exploring the deeper meaning of pain and the surrounding personal story. By stepping back and looking at all the things that were happening around the time the pain developed, many people with pain can make useful links between a worrying period of life and a worsening pain picture. For many, recognizing deeper emotions can be part of the healing process. Last, but by no means least, is physical activity and function. From the brain's perspective, getting moving at comfortable levels without fear and where the brain does not protect by pain is best, and you'll gradually restore your body's tissues. So, to sum up pain, it comes from the brain and it can be retrained, and when looked at from a whole person or broad perspective, gives you a lot of opportunities to begin. So get a helping hand if you need it, set a goal and begin.
Okay, so how did people find that video? It's interesting, isn't it? It's an interesting one. The more I see that, the more I see other things in it. I mean, I've been watching it now for almost every week for 2 years, but I still enjoy watching it because it still brings things back, and you still remember that yes, you can do something. Because we all have those slip ups where you just think, oh, I can't help myself, I can't do this. This is just never going to happen. I can't, but it does. And dealing with many different health conditions comes with its own problems itself. Just as a thing, I live with rheumatoid arthritis, fibromyalgia, osteoarthritis, plantar fasciitis, sleep apnea, high blood pressure, asthma, what else? Endometriosis, and I can go on and on and on with pain conditions. But you wouldn't. I don't show that. I don't need to anymore. It's that it actually is managed. Everything is managed by doing our courses. And I'm not just saying that because that's the way I am now. It has completely changed my life. And you see the benefits for other people. And what we do is use a toolbox. So if you just bear with me a second, I'm just going to bring up the toolbox. So this is our self-management toolbox, and this is our pain-centered toolbox. And what we do is go through each of the steps, and I'm going to go quickly through them and say what we look at with each. So physical activity is a scary one for most people, because if you've got pain or any other condition, you think that actually doing some activity is going to be a problem. It's going to cause more pain. It's going to make you feel worse. And that's really, it's not true for most people. Most people benefit from some sort of movement, and physical activity doesn't have to be going to the gym or going swimming or for a run. Physical activity can literally be getting up and down and walking around the house. Anything that gets you moving is good.
Sorry, do I think of that?
Yeah.
Okay. Yeah, the next one on our toolbox is medications. So whilst we're not medical professionals and we don't give you any medical advice, we talk about how medications can help and who you can go to help get the right sort of medications to suit you, and what questions you can ask, all right? So that you're not just accepting what you're told, you actually become in partnership with your healthcare professionals to get the right mix for you.
Now we've got decision making, which is one of the biggest tools that we use. It's basically a pros and cons list, but we add weight to that by scoring it. And then from that score, we then see whether it matches our gut test. So actually everything goes by the gut, because the gut is the most powerful tool we have. But decision making is a big thing. I had a big decision to make about my Motability car last year before. And it was a case of keep it and not be able to afford my mortgage, or take it back and lose my independence. So it was a massive thing, but I did actually give it back. And I'm very lucky that it hasn't lost my independence, because my mother decided she didn't need her car, so I could have it. So, it worked out well for me. But, that was quite a big decision, because I thought I was going to lose that independence. But putting it down on paper took the emotion out of it, and I was less scared when I made that decision. And because living with a lot of long-term health conditions can be confusing and scary, and you worry about the future and you worry about what's going to happen, actually putting it down on paper really, really, really does help.
And the next one we do is action planning. We all got goals, we all got things that we think we should do, we want to do. But what we do in action planning is choose something that's going to make you feel better. So something being totally selfish that you want to do for yourself. It's part of our plan, putting yourself first and including yourself in the mix. So action planning is a tool that we use to find something that you want to do and give yourself a goal of doing it that's easily achievable. So you're not putting yourself under pressure. And it's something that well, I know I do. I use it in everyday life to make sure I get things done that I want to do. Okay.
Yeah, absolutely. It becomes life, doesn't it?
It
It's just
does, yeah.
you work with these systems. But then the next thing you've got there is breathing techniques. So everybody can breathe, yeah. Obviously, can you breathe properly? That's the question. Do we breathe properly? And most of the answer is no. We shallow breathe. We don't breathe with our abdomen. Breathing should be like when we're babies, because you watch a baby breathe in, their stomach goes up and their stomach goes down. But we don't.
No.
Ours is all in our chest. So why have we lost that? Why do we stop doing that? And the majority of the time is because of stress and pain.
Yes.
So using our breathing techniques, there's two that we work on, but there are many out there. But there's two that we do, which will actually bring yourself back and just trying to relax a bit and try and get your breathing back to normal, or back to as it should be, not normal. Normal's a really bad word to use. But it's, bringing it back to how it should be will make it easier to continue doing tasks.
And we talk about sleep as well, because a lot of people get problems with sleep, especially when you're in pain. So we look at all different techniques and things that you can do to help us sleep. I wish we had a magic wand for that, but we don't. But we have to try different things. And we also find that when we're in the course, people share what they do as well. And the more things you can try, the more chance you have of getting some decent sleep. And it's helpful.
I was going to say that I think that subject is where I learn the most every single course that we do. And I always end up out there trying something different, and it always works for a bit. So it's a really helpful thing. Then we look at problem solving. So when again we come across obstacles. So when we come across an obstacle, do we know how we can solve that, or do we need help? So our problem solving tool is used as a group activity. So if somebody has a problem throughout the week, we then put it out to the group and see how they would resolve it. Because you're the expert. The person who's doing the course is the expert in your condition. And if you've come across these things, then how have you helped? How have you got past these problems? And that might help somebody else. So that's something that you might think isn't important, actually might be a lifesaver for somebody else. So, we say that nothing is a silly option. You can say anything, and it really does help, really does.
And we talk about using your mind, because funnily enough, your mind and your body are really closely connected, and your mind can be really helpful in, for example, distracting your body from feeling the pain. We use distraction techniques, and I always say that, if I'm feeling nervous about something, my body actually feels sick. If I was going to go on the stage and have to make a presentation or something, I physically feel sick. So we actually know that our mind does affect our body, and we look at ways that we can use our mind to help our body, right, and help our pain. And there's some good techniques there.
Yeah, there really is. Yeah. With long-term health conditions and chronic pain comes a lot of difficult emotions. And they're very difficult to understand. So we do look at these, and we try and do it with a little bit of humour, because it's a really hard discussion sometimes. Sometimes it's the first time people are allowed or allow themselves to be open and honest about things. And so we do have a section where it does sometimes get a bit tearful. However, we flip that on its head. We find out, how can we deal with it? What can we do? How can we make this better? And we'll also look at worst case thinking, because I don't know about you, but I've done that previously. I've had a new diagnosis, and that's it. I'm going to lose my leg, or, I'm never going to wake up again when I'm at this illness, or if anything happens to the car, oh my God, that's it. It's the end. And you just, your brain does this automatically, but we try and find ways to stop that.
Yes. And communication. Now, is an important thing in all walks of life. Bad communication, it can cause so many problems. And of course, when you're dealing with pain, communicating can be difficult, especially when you're trying to tell other people how you're actually feeling, because they can't see you're in pain, but they just think, oh, well, you look normal. But communicating how you feel and communicating how others can help you. Because believe it or not, I never like asking for help, never. But I always want to help others. And so you have to realize that other people want to help. So we talk about how you can tell people how to help you, how you can communicate when things are going wrong without causing an argument, and also how to communicate with your healthcare professionals. So there's quite a bit in communication just to make sure that we are communicating without causing any problems and being heard.
Yeah, absolutely.
Yeah.
And then we look at healthy eating. So we never tell you what to eat or how to eat, or, you know, you should be cutting down on this or you should eat more of this. That's not how this is. What this is general healthy eating guidelines. We do a quiz on the first section of it. We do it over 2 days. We have a really fun quiz. It is just a bit of a laugh, but it actually gives you some great knowledge into how foods work, basically. And we work with guidelines from the NHS and the government, and provide the information to the participants with that.
Yeah. And the final one is working with healthcare professionals. And this is something we talk about all the way through the course, because it's our bodies. We're not just following guidelines, we're developing a partnership with our healthcare professionals. But we also, on the final session, take your feedback on experiences that you've had with working with the healthcare system and the healthcare professionals. And that feedback goes to a report that our ex-coordinator, who's now working for Public Health Wales, she does a report to the Bevan Commission on how patients feel about the care that they receive. So we are actually feeding back on things that are wrong, but we also feed back on things that have gone right. So hopefully they can share good practice to help the NHS work properly.
Yeah, and there are things that have come up on that session that have been implemented, so it's not just falling on deaf ears.
No.
If there is a good solution, which we use problem solving within it, and we try and see if we can solve any problems that come up with the NHS, and then it goes from there. But we are an NHS course, so we're not, you know, we're not doing this to bash the NHS, because it's a fantastic thing. But we do have some issues. Everybody has issues with things, so we then work through that. So that's our tools. So the next thing I'm just going to go through quickly is how you can access our courses. So we have 2 types of course. We have an online course, which is via Zoom.
Yes.
And this is exactly how it is delivered, but normally not with 2 people on the screen, just the one. And you get your resource is sent out to you, and our tutors will help you with anything that's needed. We can also go through Zoom if you weren't aware of it, but obviously you're on this, so you've managed to do it. Then the other one is face-to-face. So all of our venues are accessible. They never start before 10 a.m. And there is flexibility with attendance if needed, because having long-term health conditions, it's very difficult to know that if you'll be able to do 6 weeks in a drop or 8 weeks on a drop. So if there are some times you can't make it, that's absolutely fine. You need to do 4 sessions to complete the course. However, if you've done 3 sessions and then you do 3 sessions of another course, when we do another one, that completes your course. So we are able to do that. Obviously, it's better if you can do the course all as one, but there is flexibility if needed. And like it says there, the ability to take the course more than once. So you can do any number of our courses any number of times you wish to, as long as you keep in contact with us, and you know, we can keep you on the waiting list and then send you out what's needed as and when. All of our information is on Facebook. It is also on the GAVO website and Public Health Wales website, Mellow, Torvine Voluntary or
Iron
Bevan website.
Yeah.
It's on a number of them. And 111 is on that. So there's lots of ways you can get in contact with us at EPP. We will also give our details, so the email address to if you want to email straight through is epp@gavo.org.uk. But again, I can send that over, and Esther can then send that out. That's not a problem at all. So with that being like the end of our sharing, does anybody have any questions? Feel free to unmute yourself.
Well, I can kickstart. I've got a couple of questions. So I was
Yeah.
quite interested, as you know, Thriving Communities runs a mind and body wellness program. We have just completed the first cohort of this new budget year. So it's been cohort 6. We've been running it for the last year in Llanbradach. And we do focus a lot on breathing techniques. You mentioned that you use 2. I'm just curious which ones they are.
Yeah. So we use belly breathing and pursed lip breathing.
Oh, there you are. So yeah, there's the 2 we've just done Mammy and I delivered a session for GP trainees. They were a wellbeing day was organised for them last week, and yeah, we had a great show there. We had over 100 people, and they were all practicing this.
Oh, fantastic!
I know. Yeah. So we know. I mean, as you say, a lot of people just breathe shallowly. We sit here. Postures actually doesn't help that when we're stooped and hunched over our phones or our laptops. So good posture is always very important to get the right breath and get that deeper. Use all lung cavities.
Yeah.
So yeah, the other thing is, because you mentioned that you do these courses, this particular one included, in person, face to face.
Yeah.
So where are they all held? Are they held in different locations, or they rotate?
So it's all participant based, basically. So if we have enough people to run a course in an area, we will find a venue, book the course, book the venue, and then we'll run a course from that. It all depends on where people want to go. So the next in-person one we have is in Chepstow, I believe, isn't it? And that is a chronic pain course.
That's right.
On the 15th.
The 18th of September, and it's in Bulwark Community Centre in Chepstow. Okay. We're hoping to run one in Cwmbran in early next year.
Yeah, it'll be January. We got
and maybe Newport, and there's a couple in Blaenau Gwent as well.
Yeah,
coming up.
Yeah.
So we'll send you a course list, Esther.
Okay, lovely. Yeah, because I think the others, but we also discussed if we could get how many as a minimum would you need participants to create a new course? Six. Yeah. So if we had enough demand from our own group and following,
then perfect.
Absolutely.
a bespoke one for our group.
Absolutely.
Yeah. I'm just going to check the chat now whether we've got any questions.
That's fine.
So Sangeeta says, thank you for informative presentation and useful video. Thank you, Esther and Thriving Communities for arranging. And Mel said, really helpful. Thank you. So yeah, anybody else, feel free. And if you don't want it recorded, that's fine. We can stop the record. But yeah, feel you make use of this forum or this platform to, ask experts or people that have dealt with experts as well. Obviously we can't be an expert of everything, but certainly more knowledgeable than we are on pain management. So yeah, fire away.
The other thing I want to say
it could be a simple question because some people are embarrassed, but maybe a question that somebody else has got, certainly if they're watching on record and they might find it useful.
Yeah, well, anybody in contact us anytime, that's not a problem at all. But what I was going to say was all of the tutors that we have are volunteers, and they all have long-term health conditions, most of them pain. So when you do a course with us, then it is with people who can understand. So it's not with somebody who's just throwing information at you. It's somebody who's lived this, and because they love this course so much, and because they want to get it out to as many people as possible, they became a volunteer, which includes 4 days of training. So it's not just an easy, oh, you can do this. It's 4 full days of training, at least. and then going out into the community or online to do them.
And then a trial, they have 2 assessments for the first 2 courses just to make sure everything's right. And we have ongoing QA, assessments. So, but we all actually talk to share good practice, and yeah, we sort of make sure that we're following all the standards that are set.
Yeah. So what the next question is that you know, if they go on the course, it'll obviously be more in depth. That's what's
absolutely.
Yeah.
It'll be more like pinpointed towards everything exactly. You know, it when you come on a pain course, you'll have people with many different conditions, but what you'll find is that the symptoms will be the same. So it doesn't matter what condition you have, the symptoms you have, and also when you look at difficult emotions, the reasons for difficult emotions will all be so similar. And when you're going through these, and when everybody's sharing, because we are interactive, we do get people to talk, we do open it up to everybody. We write a lot of things down on a whiteboard so you can read online, and we do it in person as well. And you write down what has been said, so you can keep looking at it to say, "Oh, yeah, I can see that. That's exactly the same as me. That's how I feel." And it's really eye opening. And then there's things that come up that you think, "Well, I didn't even think that was linked to this," and there could be, and you learn a lot from other people and how people do things, and it's honestly I'm not trying to get you on a course, but it is one of the best things you can do if you have long-term health conditions or pain. Like I said, we have a number of courses that will help. I can guarantee it will help.
We'd love to invite you back, because I know there were several other subjects that will be of interest to our audience and followers, definitely. So yeah, we'll liaise further on that.
Absolutely.
Thank you very much, appreciate that. So if nobody has any more questions, we'll finish it there. And as I said, perhaps you could drop a message to me in the Facebook if you want the links that we're going to share. We can also put it on email. So yeah, just reach out. So if you send an email to hello@thrivingcommunitiescic.org, I will share with you all the links that Amanda's mentioned and Helen. So and the video, obviously, that would be useful too for some people to rewatch, because we know we pick different things out each time, don't we? Yeah. So thank you very much for giving up your wonderful time, your precious time, and your obviously expertise, sharing that. We really appreciate it, and we look forward to seeing you again, perhaps on another subject.
Yeah, absolutely. Just let us know, and thank you all for coming. It was lovely to meet you all.
Yeah, and thank you everyone, for all the participants, all the group members. So please do share the word. We have got another one coming up in a fortnight. That one is on brain health. So somebody from Anaya and Bevan University Health Board will also be talking on that subject. And some of you may have heard it before, but as I say, you sometimes can't hear something enough. So, for the extra bit of wisdom or learning that you get each time. So do participate as much as possible in these health talks, and it helps obviously the speakers, because it makes them feel like they're making a difference, and it's worthwhile, and spreading the word. Thank you very much. Thank you all. Have a lovely day. Thank you.
Thank you.
Thank you.
Bye-bye. Bye.
Bye.